Alright, so today we'll be inserting an IV. Before I go in, I would verify my provider's orders, gather all of my supplies. I would take tape, some alcohol prick pads in case, some cotton balls. I would have my little pigtail for my flush. I would also have a flush, my catheter, my IV catheter, and then an IV catheter starter kit. So I would go ahead and enter the patient's room. Hello, my name is Catherine. I'll be your student nurse today. The provider has ordered an IV insertion. And so go ahead and put my supplies down. And hygiene. And just to make it easier on me, I'm just gonna kind of get down here so that I have good view of where I'm inserting. Of course, in a real setting, I would have, if it's in a hospital setting, I would have the patient at working height. So before I start, I'll go ahead and open up my supplies. Go ahead and pop this so that way it'll start. Okay. Go ahead and set this under. We would do distal first. That's how we're gonna work. And then I would have the flush and the pigtail. Go ahead and flush the pigtail. So that way I'll have that ready. Go ahead and get my IV catheter out. Set that there. Go ahead and have some tape out. We'll just say that, you know, we've got some tape out. Kind of sitting on the side, ready for us. Alrighty, so go ahead and put the tourniquet on. Alright, and so I would go ahead and want to look and feel for a site, see where there's a good vein, preferably one that's kind of straight. So go ahead and feel one right here. All right, we'll go ahead and clean 30 seconds. All right, so we have it cleaned. Go ahead and pop this, bevel up, of course. Hold that skin taut. Go ahead, and it's kind of like a 45-degree angle. All right, and I do have flashback. So what I will do is with this finger, I would, once I have the flashback, I want to advance the catheter. And usually once it advances, it'll, you know, the edge of the catheter will be right there at the entrance of the skin and the vein. So once I have that, usually it'll lock and I'll hear that click, and usually I'll have that flashback. And I'll go ahead and kind of get this unscrewed a little bit. I'm going with this hand, I'm going to hold pressure and let go. Through that, I would put my flush, and I can go ahead, once I've got the flush on there, I can go ahead and, you know, if we have to flush it or anything like that. I want to pop my tourniquet. So we've got everything. There was flashback. The needle was properly in the vein. We've got the little, you know, flush. We've got the little pigtail connected to it. Once we do that, then we'll go ahead and put our little covering on there, and we want to make sure that it's in that clear area where we can view it. So once it's in place, we can, you know, make sure that we're assessing the site, making sure that there's no like bleeding or drainage, or that it's turning red or causing any infection. So we would have that, and it's in that clear area. Once we do that, I would go ahead and put that little sticker, date it, sign it, and then we would also go with our tape. We would secure it, making sure that it stays in place. All right, and then of course, once we finish that, we've got the IV in place. Go ahead and clean all of our supplies. Anything that needs to be thrown in the sharps container, if there's needles or anything like that, and then just go ahead and throw this away. Make sure that the patient is clean, comfortable. All right, same thing, we'll throw that away. Hand hygiene. Alrighty, and once I finish inserting the IV, I would go and document the gauge. So it'll be like an 18 gauge. It flushes very well. There was no signs of like any welting or, you know, that it was not in the vein. So it was inserted properly. The patient tolerated well, and I would continue to assess it and also document the time and date that it was inserted and how many attempts, and just kind of, you know, how we applied it. And I will continue to assess it. And that concludes the IV insertion.